Today we'll discuss a trial of pregabalin for acute and chronic sciatica. Pregabalin is an anti-epileptic that's used for a wide variety of different types of neuropathic pain, all the way from diabetic peripheral neuropathy to fibromyalgia. Since pregabalin is already used for different types of neuropathic pain, it made sense for them to ask why not see if it works in sciatica. The PRECISE trial was a randomized, double-blinded, placebo-controlled trial that took place in Australia at 47 different sites. The trial was divided into two different groups, those using pregabalin 75 milligrams twice daily and a placebo. Participants of the PRECISE trial had to have pain below the knee, an episode of sciatica lasting a week to a year, and be 18 years of age or older. This pain had to have moderate influence over their activities. As far as exclusion criteria, it was mainly focused on pathology of the spine. Outcomes were measured through participants calling in to consults either by phone or inputting their data on an online database. Primary outcomes were measured at 8 weeks of treatment, while secondary outcomes were also measured at 52 weeks of treatment. At any point in time, the medications could be titrated accordingly to the patient's needs. The primary outcome for the PRECISE trial was the average leg pain intensity over the previous 24 hours at the 8-week mark. They measured this using the standard pain scale of 0 to 10. Secondary outcomes included extent of disability, back pain intensity, quality of life, global perceived effect, healthcare utilization, and work absence. These were also measured at the 8-week and 52-week marks. 86% of all participants were able to complete the trial for the entire 52 weeks. 94% of the patients in the pregabalin group were able to complete the trial at 8 weeks for the primary endpoint, and 92% were able to complete at the 8-week endpoint for the placebo group. So what did the results say for the primary endpoint? Average leg pain intensity, they found no difference between the two. Pregabalin group had an average score of 3.7 in the pain scale, while the placebo had 3.1. This trend continued even with the secondary outcomes at the 8 and 52-week marks. Safety was assessed by looking at the number of adverse events found in each group. Pregabalin was the leader with 68 participants having adverse events, the most common being reported as dizziness. So what does the PRECISE trial have to say about pregabalin being a good option for acute or chronic sciatica? To sum it up, no. Pregabalin offered no benefit over placebo and was associated with more adverse events in the patient population. For more information regarding this trial, please click the link provided below. Thank you for your time.
Created using Powtoon.